Hi, I'm Dr. Jeff Soldatis with OrthoIndy, and I'm going to be discussing hamstring injuries and their appropriate treatment. Basically, what we're considering is a complete rupture of the proximal hamstring, so where the actual muscle is attached to the hip bone or the ischium. And we're looking for a rupture of two, if not all three muscles. We're not really too worried about injuries that are in the muscle itself, which is more of a mid-thigh kind of injury. Again, we're looking at proximal injuries, or injuries up near the butt bone, if you will, the ischium, right where the tendons attach. And the surgery will vary just whether it's all three tendons or two of the three tendons, because sometimes we can work off one tendon that's still attached. Generally speaking, we want to reattach the tendons at the ischium bone or the hip bone or the butt bone, our sitting bone. Essentially what we're doing is placing some anchors into the bone. These anchors are actually made of a suture material, and they each have 4 sutures that come up out of them. So we'll use usually 3 or 4 of those, which will then equate to 12 to 16 sutures, which are brought up through the tendon, and we are actually reattaching the tendon to the bone there. We're not really doing work further down. Those are different type of injuries that usually don't require surgery when they're into the muscle portion of the hamstring tendon. We actually can see a number of different kinds of injuries, and that's important to understand. It usually is from an injury. This is not something just walking down the stairs and you tear your hamstring where we're going to have to repair it. It's usually a fall down the stairs, or common sports where we see injuries are water skiing, occasionally snow skiing, believe it or not, golf, when golfers are trying to retrieve balls from down a hillside and they slip and fall. And the other then would be, I've had several ice hockey players as well. Surgery usually lasts about an hour and 15 minutes. That gives us time both for exposing the hamstring muscles, which are under the large muscle of the butt, the gluteus muscle, and to gain exposure, isolate the hamstring, make sure it moves well. And sometimes we also have to work right next to the sciatic nerve, which may have some scar tissue around it. If that has a lot of scar tissue, surgery might be a little bit longer because we need to make sure that nerve moves well. If you want to learn more about our OrthoIndy services, please subscribe to our YouTube channel. If you think you have a hamstring injury, especially if it's acute, we want to see you early. And we can do that either through contacting the practice, or you can be seen through one of our urgent cares.